Hello. Okay, so we are on this next slide about ventricles, meninges, and CSF is what it's titled. Remember the ventricles? We talked about this a while back. We talked about Galen, who thought that the fluid and the ventricles represented the mind, the spirits. Remember? The fluid and the ventricles represent the mind. He was a dualist. Well, that's the ventricles. What are the ventricles? There are four cavities in the brain. So think vent. What is a vent in the ceiling or something like that? It's a cavity, right? So ventricles are these four cavities. We have two big ones that kind of arc around. You can see in the picture called lateral ventricles. And then we've got the third and fourth ventricle, which are kind of in the middle, which funnels into a small tube called the central canal in the spinal cord. So that fluid that Galen observed, which he thought was the mind, what is that actually? Well, it is what's called cerebral spinal fluid, CSF for short. Cerebral, brain, spinal, spine, and fluid. Now it has three purposes I'm going to talk about. So the purposes of CSF, it keeps the brain afloat, cushions the brain, and has nutrients. Now the first two, keeps the brain afloat and cushions the brain, may not make much sense yet, but allow me to explain more. So this cerebral spinal fluid, this essential fluid, which is made by cells called the choroid plexus in the ventricles, is also in the meninges. Well, what are the meninges? Have you heard of the meninges? I bet you have. You're probably going to say, no, what the hell are the meninges? You've heard of meningitis? Then you've heard of the meninges. So the meninges are layers between the brain and the skull. Also between the spine and the spinal cord. So there's three layers. You have the dura mater, which is closest to the bone, which actually means tough mother. It's translated into tough mother. You got in the middle the arachnoid layer. What's an arachnid? It's a spider. So it looks like kind of like a cobweb layer. And then you got the pia mater, which translates into soft mother, next to the brain or to the spinal cord. So you got these three layers that make up the meninges. And the meninges have some cerebral spinal fluid in it. So I'm going to do this example in class, but imagine if I've got this glass here and I drop a ping pong ball. There's some water in it, but let's say there wasn't any water in it, okay? So if I drop a ping pong ball to simulate an impact to the head, well, the ping pong ball would hit the skull. Ouch, not good, right? Because that can cause a contusion, bruising on the brain, concussion. So what this fluid does is kind of cushions the blow. So imagine that I've got this filled with water and I drop the ping pong ball. Well, what's going to happen? It's going to cushion the blow, right? It's like if it fell on a cushion. Yeah, I don't know what else to say. Yeah. So the purpose of having the cerebral spinal fluid in the meninges is to help cushion the blow to the head. Now, it's not much of a cushion, okay? I mean, even football players with helmets on, can get really injured. So, it's better than nothing. Let's put it that way. Now, it also keeps the brain afloat, supports the weight of the brain. So imagine if I had this filled with water and I had a ping pong ball in there. So this representing your skull, the ping pong ball representing your brain, and the liquid representing the cerebral spinal fluid. It'd be floating in there, right? So it supports the weight of the brain. If you didn't have that support, then it would put too much pressure on the skull, the bone that's inside, the bone that lays on the bottom of where your brain's located. I forget what the name is what that area is called. But anyway, so it's like, how does a boat keep afloat in the water with its huge weight? Well, it's all about buoyancy. It's all physics, right? So a lot of people think the brain's in there like cement. It's not. It's actually kind of floating around a little bit. Okay, so to summarize this slide, we got these ventricles that Galen talked about having this fluid in there that he thought was the mind. Well, those ventricles are four cavities in the brain, but they're filled with cerebral spinal fluid. And the cerebral spinal fluid is also in meninges, which are layers between the brain, the spinal cord, the brain, the skull, and the spine, the spinal cord. And the three purposes of the cerebral spinal fluid is for nutrients, for having a cushion for the brain for impact, So if it gets hit, there's some kind of cushion. And also to keep the brain afloat, to support the weight of the brain in there. Now, a couple more things before we move on. You guys have heard of a spinal tap. So what is that doing? It's actually sticking a needle into the lower part of the spine and into the meninges to extract cerebrospinal fluid. What it's testing for is meningitis. So meningitis, the inflammation of the meninges, can be tested by testing the cells in the cerebrospinal fluid. But they don't get the cerebrospinal fluid from here. They actually get it from the back. So that's what a spinal tap is. It's going, the needle sticking into the meninges, extracting some cerebrospinal fluid. How about an epidural? You guys have heard of that. An epidural is what a woman in labor takes to numb the pelvic area when she's having, so it doesn't hurt when she's having a baby. Now here's the thing. Why do they call it an epidural? Epi is above. And remember I said that one of the layers, the first layer of the meninges is called the dura mater. So there's a space above the dura mater called the epidural space. So what happens is they stick a needle into the epidural space in your lower back. And that's giving anesthetic and anesthesia medicine to numb that area, to the pelvic area. So that's why they call it epidural. It's going to it's sticking the needle into the epidural space in the meninges. All right, next up, strokes. So this is something that's kind of personal to me because my mom experienced problems with strokes and now has a form of dementia. Like Alzheimer's is a form of dementia. She has a form of dementia because of it. I'm not gonna talk. This has been a long video, so I'm not gonna get into it now. Maybe I'll talk about it in class. We'll see. But to define a stroke, it's a starvation of blood to part of the brain. So it's kind of like a heart attack in your brain. I actually rather have a stroke if I had to pick one. I mean, obviously I don't want either. But I'll tell you why. Because a heart attack cuts off the blood flow to the entire brain. Stroke is a cut off of blood to part of the brain. So in that sense, I think a stroke is actually better. Now there's two types of, actually before I move on to that, why is a lack of blood flow bad? Well, what's in blood? Oxygen, nutrients, glucose, which is the fuel for the brain. So you cut off the blood, you cut off those supplies. Without that, it dies. So that part of the brain dies. So there are two types of strokes, ischemic and hemorrhage. Now a hemorrhage is bleeding out. Ischemic stroke is a blockage. Well, what could cause a blockage? Well, imagine, okay, so this is your artery here. Over time, you can have plaque that builds up. Some people more than others because of their diet or lack of exercise. But as plaque builds up, it narrows the artery. And so it narrows the artery to the point that just a small little blood clot can get stuck in there. And then it's kind of like pinching a garden hose. Well, what happens when you pinch a garden hose? Well, water doesn't get to, or very little water, gets past that point where you pinch it, right? It all kind of builds up in the back, behind where you pinch it. So it could be, actually, it could be in some people that plaque is completely filling the artery. So it's completely occluded or blocked with plaque, which is pretty bad, right? Yeah, and that can happen. Actually, pretty much in my mom's situation, that happened. So it could be one of three things. It could be a blood clot that's a really big blood clot, could come from your heart that gets stuck in an artery. It could be plaque plus a blood clot, and it could be just plaque that gets in there. So ischemic strokes are the most common, more likely as you get older, but it could happen at any age. So we'll talk about the symptoms in a little bit in the next video, but hemorrhage is bleeding out. So going back to our hose analogy, so ischemic stroke is like pinching the hose, right? So some of the hose is not getting water. Hemorrhage would be like if I take a knife and cut open the hose so that water's leaking out. So a hemorrhage is blood leaking out. Well, if it leaks out, then that means some of that blood doesn't get to where it needs to be, and that part is deprived of blood. So what could cause a hemorrhage? Mostly it's like a blow to the head, like a fall, some type of accident. Not always the case, but I I think that was the case. I don't know if you guys remember who Gary Coleman was. He was played Arnold in Different Strokes. He was the guy who says, what are you talking about, Willis? That guy, little black guy. He died of a hemorrhage. Bret Michaels, he played in a band called Poison in the 80s and 90s, I guess. He was also, let's see what else. He was on a show called Rock of Love in the late 2000s, I think, on MTV, a dating show, reality dating show kind of thing. He survived, but he had a hemorrhage too, I believe, from a fall. So bad news. Now, with ischemic strokes, there is a medicine you can take. So if you have a blood clot, what do? You take a blood thinner. Bayer aspirin is a blood thinner. In fact, some people take that every day to reduce chance of heart attack and stroke. But a stronger medicine for a blood clot is called TPA, or tissue plasminogen activator. Plasma, you guys know what plasma is? It's a component of the blood. So it's a strong blood thinner. But it has to be taken within like 3 hours of the stroke, otherwise it won't work. So time is of essence here, as it usually is with medical emergencies, right? So TPA can help break up the blood clot. It's not going to break up the plaque, though. So what happens if you have plaque? Then that you could get surgery, or you can have something my mom had, which is called a stent. And it's a mesh device, like a chicken wire metal device. It's got an uninflated balloon in it. And they put it through your wires, excuse me, they put it through your arteries, which are kind of like wires, but they put it through your arteries, and they go to the area where the blockage is. Then they inflate the balloon, and inflates the, or expands the metal device, and opens up the artery. The problem with that is some plaque can break off and go block some other artery, which is actually what happened with my mom. And she had a massive stroke due to the procedure to help her, prevent her from having a stroke. But yeah, so that metal stent is, so the balloon opens it up and opens up the artery. Okay, so so the TPA is not going to work if it's just plaque. That's only going to work if there's a blood clot. Okay, what happens too if you have a hemorrhage and you take TPA? You got a problem, right? If you have a hemorrhage bleeding out and you're leaking blood and you take a blood thinner, not good. So yeah, there is a risk of taking TPA if they're not sure if you have an ischemic stroke. They think you have a stroke, but they're not sure if it's ischemic or a hemorrhage. TPA could be dangerous. But then again, most people, you're more likely to have, if you have a stroke, it's an ischemic stroke. So some symptoms of stroke, anything, we're dealing with the brain here, right? So depending on where it's affecting the brain is going to determine its symptoms. So anywhere it affects, any kind of cognitive problem, speech problem. It could also cause paralysis, numbness on one side of the body. So let's say that, if the stroke is on the right hemisphere, then you might have paralysis and numbness on the left side of your body. Some people describe pain, some people don't. Some people just have facial drooping, so their lip will kind of like hang down a little bit on one side. So if you have facial drooping on your left side of the brain, stroke could be coming the right side. So sometimes it's kind of scary because it's hard to identify these symptoms. They're not so salient. They're not so explicit. They're kind of more hidden. But yeah, if you feel these symptoms, especially if it's acute and it's sudden, get to the ER immediately. All right, we got one more video for Chapter 3, and it's long, on plasticity, so I'll do that one.